Hi, everybody. Today with me is Yusuf Salam. He's currently a student. I hope I said it right, buddy, but he's
Yeah,
currently a student at University of Alabama. He's originally from Egypt, and I had the opportunity to meet him in Alabama when I go to Dental Foundry for my implant courses, and that's how we got to talk to each other. And recently, I know a lot of people are interested in applying to UAB. Some of them got invites preparing for the bench exam, and I wanted to ask you some questions regarding it. So thank you, Yusuf, for being here and giving us your time.
yeah. Thank you for having me, Adriel. Yeah, it's been nice knowing you, and uh, yeah, and I hope this helps as many people as it could.
So just to start off, how many spots do they have at UAB right now? What's your class fellows like? How many number do you have?
Um, so I think my uh, my class and the class below me, they're roughly around 24 to 28,
And
maybe.
how's the diversity? Like diversity wise, is it how
Oh,
many are Indian?
it is pretty diverse.
So
You
you
have,
have
yeah.
how how many, like, tell me roughly, like what's the number would look like?
So let's say, for example, I'm Egyptian. There's maybe three other Arabs or four other Arabs. There is
How
a
many
f-
Indians?
uh, probably around five,
Okay, then you must have
which
diversity.
I mean, yeah, and then the rest are there's Latinos. There is people from Iran. There is yeah, it's
Oh, wow.
everywhere. Yeah,
And
some
what
Nigeria.
about experience-wise diversity? Are they mostly fresh? Like you're comparatively a fresher grad, like you're a
Yes,
younger
yes,
person.
yeah.
Uh, but do you think, like, when you look at their experiences, are they more masters people or GPs or mass?
It
Like
every Yeah, it varies. It varies completely. Like you said, I'm a fresh grad, as you can say.
comparatively, yeah.
Yeah, and then you have people who've been opened up, like had their own practice running for 10 years, and they decided to come to the US. You have people who've been doing residency and coming back to the US doing peds. Yeah, it's there's a whole different variety of different
Okay.
backgrounds.
So I'll talk to you more, but most probably people who are watching this wants to know about how was your last year admission process. So imagine back 1 year ago, you got this invite from
Mhm.
UAB, and how many invites did you get overall?
I got only two. I applied to eight schools.
Uh-huh.
Um, and looking back at it, I realized that I could have done better at my TOEFL score. I thought my TOEFL was good, but I
What was
realized
it?
if I can't remember. I think it was maybe 97.
Okay,
Was
so
was-
here's the thing with Middle Eastern candidates, Egypt, they were forgiving with you because Egypt is still a English speaking British colony. They have that influence, but with Middle Eastern community, they are not very tight. Like for
Mhm.
Indians and other community who have higher TOEFL score, they are very picky. But that's good. You got it with 97. So when you got the invite, so one was UAB, other was.
That at that time it was maybe around May where I got the invite,
Mhm.
like early May, and they asked me um to come for the bench test.
Okay. What did you get another invite too from another school except for UAB?
Uh, yeah, but that was later. I only
Which
accepted.
which one was it, by the way? Just to get
It was tough, but then it
okay. You
was
didn't go.
yeah.
So now when you got the invite, I know last year they did the bench exam, the interview. So how was it for you last year
Uh, the last year or the year I was
when you went through the
was
bench
applying.
exam, when you went through it?
That year I was practicing as a dental assistant. So as I was applying to the schools and doing all the application process, I was working as an assistant, and I used to like take time off to go do the TOEFL or do certain application processes. But yeah, I remember they asked me to come in June, early June. um, to come to do the bench test. And yeah,
What was in the bench test? What did they
so
make you do?
they didn't specifically tell us which teeth we'd be doing, but they mentioned we're gonna be doing class two prep for a composite restoration
Uh-huh.
and a zirconia crown preparation.
Okay.
But yeah, and you don't have to restore the composite restoration one.
That's good. So mostly I people keep like candidates, I keep telling them almost every school who takes bench exam, 95% of them will either make you do a crown prep and a class two on a maxillary tooth. Because all of these bench text exams goes back to ADEX, like which you're going to take next year. So
Mhm.
if I'm preparing for one school, you can prepare for all the school because the teeth is going to remain the same. The crown prep principles remain the same. So was it very stressful when you went for the bench exam? How was that your experience waking up that morning? Did you had loops? How was the environment for you at that time? Must be tense.
Uh, I actually didn't know about the fact that they all go to ADEX, but that's pretty interesting. And maybe now that I look back at it,
Yeah,
I think
it's
it
so
makes perfect sense. Yeah.
let me tell you this thing. In the past, they accepted people who got accepted, but later on they could not pass the ADEX exam, and the school
Mhm.
get a bad reputation when people don't pass ADEX. And the schools were like, okay, what could we do? So they said, now before hiring any foreign trained dentist, let's make them do ADEX exam. So that's what they are doing.
That makes sense. Yeah.
So how was your experience? Was it stressful? The sim lab, how was it at that time?
Honestly, it was very well organized. The coordinators we had Dr. Chavali and Dr. Mitchell helping organize the whole bench test. It was very organized. We got the exact instructions of what would happen, where we'd sit, um, and like a map of the place. We got a tour beforehand of the school. Um, and there was IDP students there giving the tour. So I mean, it was a very, welcoming
Environment.
experience. Yeah.
Mhm.
Um, but then when it comes to the bench test itself, obviously I mean, a bit more than nervous. Um, I didn't have like an at-home handpiece or whatever, or I used to practice in my dental office with
Where were you living? Where were you living
at
before?
that time I was in Austin, Texas.
Okay.
So yeah,
So
I didn't get to practice much for it, and I didn't have any loops as well. But I mean, uh, I was kind of like right out of school, so
mhm.
I sort of
And
had that idea of how to work on plastic teeth.
I know
Um,
you guys, like I in my class, the Egyptian students, like our top ranking students in my Colorado batch were Egyptians.
really.
Oh yeah, because you guys from which university did you study at?
I went to Charles University it was in Prague.
Okay, okay.
Yeah,
It was, but most people I met from Egypt, like
yeah,
they have very good pros and restorative
that
overall
is
in
true.
Egypt.
That is
So
true.
people who were coming from there, they were really good in restorative and pros. Like most third world countries are very surgery oriented,
Mm,
but I was amazed. Like uh, Egyptian candidates, overall Egyptian students have very good pros, and they would say like this is nothing. We have done so many crown preps in back home, and they are
yeah.
very picky, and our exams are very picky. So I felt like they had very good foundation comparatively.
That is, yeah, I can see why, because back universities in Egypt, you have all sorts of like patient pools, and you definitely get to practice a lot.
That's good. That's good.
Yeah.
So, your interview right after the bench exam, did you had the interview the same day or the next day?
Uh, my interview was, I think, a few weeks after
Okay.
the bench test. Yeah.
So, how was the interview for you?
It was pretty straightforward. I mean, the interview was split into sort of a clinical part and and the personal part, if you can say so. The clinical part was relatively simple. Like the questions they would ask were uh, were questions about like they would give you radiographs of like they give you a bite wing, they give you like a OPG of certain cases, and you would simply just talk about it. Make if you make the basic a basic diagnosis, they will be completely satisfied. And
Did they ask you the tooth numbering system and the quadrant before that?
um, if I can remember correctly, I think they do. Yes.
So
Yeah.
Colorado was the same. In Colorado, let me tell you what they do is they tilt the PA. So you kind of
Mhm.
like say this is a maxillary right side, and I can say tooth number 324. And then
Oh,
from there you say area of concern is tooth number 3. And then from there you kind of give like what I see, like there's periapical radiolucency, or there's
yeah.
caries.
I would say it's very similar to
Okay,
that.
good.
It's very similar.
So what I've done in the past is the candidates I prepared for Colorado and these kind of things, I've recorded like sessions for them. So if they are watching right now, if they are interested, they can reach out. But did they ask you like treatment planning and stuff, or like, okay, you told the diagnosis, right? But do they ask you like more related clinical questions?
I think the most they would ask would be what would the next step be? As
Okay.
simple as that.
So kind of like
Or
how would you diagnose and how would you treat it, just to
yeah,
see
or
like
like understanding, knowing that if the problem A exists, this is the solution for this problem.
makes sense.
I think
How long was it? Do you remember?
was about an hour, maybe less, 40 minutes,
Okay.
40 minutes to an hour.
And what about the other questions beside
Uh, Clinically,
No. Yeah, was there any other clinical questions?
there were some questions about about materials, like dental materials. Um, but I can't remember honestly the specifics. Like it was.
Usually I've seen they would ask Kennedy classification. That's a very favorite thing for schools to
Oh,
ask.
really? No,
Or
I didn't get asked that.
or composite, they will ask about different type of composite or the properties,
Yes,
the C
that
factor,
might.
the
Yeah.
C factor, putting it in increments and everything that is irrelevant in the practical world.
Yeah,
But
exactly.
but I
But yeah,
tell you,
it was pretty simple to put it forward.
okay.
I don't think there's a need to
See,
like study for
you,
it.
that's the thing. This is people who are watching this need to understand when he says it was pretty straightforward, it depends on his previous education. He was coming right out of school, and the education system is in Egypt is very strong in restorative and pros. I personally, that's what I've seen. As compared to somebody who's been out of school for 10, 15 years, and like for them now going through all of this and explaining can be a little bit different too. So
Mhm.
know that in comparison. So what about the questions when they say like, tell me about yourself, like the other personality related or ethical scenarios?
Yeah, obviously you have to kind of be prepared to sell yourself or make sure y- you've done a bit of research about the school itself. You don't want to go in blindly, not knowing where the school is or how long the school has been
So
established for.
I'll touch upon that part, but what about the personality related question? What were the questions like? Tell me about yourself. Can you?
Yeah, yeah, the basic. Tell me about yourself. Why do you want to apply to this school? Um, what tell us about weaknesses and strengths. Yeah, the simple interview questions. I don't. It was less of an interview in my case. It was more of a conversation.
Conversation. Yep. They make it feel like so usually most school will say, tell us about yourself, your strength, your weakness, leadership role, what's your long-term plan, why do you want to come to this school, tell us about a
Mhm.
time when you failed, how do you manage stress, uh,
All these, yeah,
these kind of questions. Tell us about teamwork, volunteer work you have done, how will
exactly.
you contribute to the community, define success, blah blah blah, these kind of things. And when I prepare people for interview, these are the basic things I like to touch upon. But obviously, they would go into your story too. Like, for example, if you're coming from Egypt or you worked in Austin, they will like to ask, what kind of work did you do? Or what did you
Mhm.
learn? Or what did you see? So now the question comes, when if somebody is trying to figure out, like, if I've been to Alabama, I a lot of people I've been working around are graduate of UAB, including at the dental foundry. But what things are unique about UAB? Like, I know every school has something that they are very proud of. Like Colorado is proud of a holistic view, and the school has digital lab and these kind of things. So when it comes to UAB, what are the things that they like to hear about themselves, or they are really proud about themselves?
I think UAB is known as like very is known for its surgical program, the oral surgery. We're also known for if you've heard about BioHorizons,
Mm-hmm. Implants.
um, the implant system. Yeah, the manufacturer is just right around. It's in Birmingham, Alabama.
Mm-hmm.
So yeah, I could tell you that surgically UAB is a very good school to like have a good experience in terms of oral surgery. Um, and also, I think clinically for students, it's a very well you the student gets to work a lot. I mean, there's a lot of requirements we have to do throughout the year, and I think
Like,
it
how
got
many crowns? Like, when you say a lot, what do you mean by lot? Like, how many crowns? How many?
around 25 to 30,
At least.
25. Yeah.
Okay. What? Okay. What else? What else UAB? What makes UAB? What do you feel personally that the school thing that you would say stands out in your program, IDP program?
And the IDP, I think the course directors were I don't want to say uh
You still have 1 year. Be careful.
yeah, no, no, honestly it was it's only a positive experience for me. I mean, obviously there's the first semester, which was like the preparation kind of semester where it
Yeah.
would be theoretical. That was a
Oh,
pretty, intensive condensed uh
it's like a boot camp. They condense everything. You have to
exactly.
do
Yeah.
fast, fast, fast.
Yeah, and you have to study all sorts of systems and all sorts of departments of dentistry. Uh, but it was only possible. I mean, it was very well condensed and well fed for us through the Dr. Chavali and Dr. Mitchell. Honestly, they did a really good job. I think the course directors made it very organized, and it wasn't as chaotic as I expected it to be.
Okay. So
Yeah.
now here's a question. If you were uh, giving advice to the 2 years younger version of you, like, you would imagine if you're giving advice to your own self, and obviously now you're accepted, you're in the school, so when you're talking, you're much more relaxed. But you have to go back and give yourself advice. You're applying to Caapid, you're coming from Egypt, you're stressed out, you're working as a dental assistant, you're paying so much money, you're doing all of this. What advice would you give them?
I would say I would say take your time studying the TOEFL because I went through TOEFL like thinking I was prepared and everything, and I just went one time uh, and expected it to be an easy or not easy, but I expected to be, you know,
That's very common. That's very common. Right now, I wish there's so many people who call to me and they're like, oh, can you help us with the Caapid program? Like, I help them with interviews, with writing personal statement, with applying to schools, everything. And then I ask them, like, you done your TOEFL? Oh, no, I'm going to give it next week. And I'm like, have you prepared? No, I'm going to start preparing. I'm like, you don't even know, like, how
yeah,
serious TOEFL is. Because right now, last year, UPenn said there are 1,700 people who applied. When I was applying, it was 1,000. So the number is increasing. And
yeah,
when TOEFL is one of the main thing, they filter out people. They they kind of figure out whether they're going to get accepted or not. And I keep telling people, like, you don't, I know people who have given 16 time TOEFL. People get stuck and they get stuck bad. And when students come in and they are like, la la la, I'm gonna go and give TOEFL, I'm like, you don't even know what you're going
Yeah, that
into.
was me.
And it demoralizes you. You fail a couple of times, then you feel like I'm a failure, and it's not good. But coming back to it, because I prepare people for interviews, and comparatively a lot of people are reaching out for UAB prep, like what advice will you give people who are preparing for interview right now and bank
Honestly,
exam?
I remember I had to before any interview, obviously I wanted to be as prepared as possible. And I think with you experiencing different dental schools and experiencing different application processes, I think it's good if someone like you would help others. If I had your availability back in the day, I would definitely have taken it. And I mean, there's no shame, seeking for help in these cases because it's important. It decides your career, to put it simply. Um, but yeah, I remember I would prepare. I would go over some lines, maybe memorize different templates. I remember I would when they asked me about myself, I had something like a phrase memorized to kind of help me transition into the whole interview process smoothly because I don't want to be kind of like I am right now, stuttering and not knowing what to say next. But yeah, I mean, I wanted to be as fluid as possible. Not, I wanted to sell myself basically.
Yeah, look
Yeah,
confident. That's the main thing. I tell people bench exam is like maths. Either you will know it or don't know it. It's a mechanical skill. You can't fake it. But when it
100%.
comes to your confidence, somebody might be a really good dentist, but if they are not confident enough, they people will think they are not good enough. So if
Mhm.
you're confident in your in an extroverted, and I feel like good looking people get advantage because of favoritism too. This is a universal fact in interviews. So preparing yourself good, acting confident really helps out.
100%.
That's for
Yeah, I
sure.
agree. Yeah,
That's for
making
sure.
sure you look presentable. Yeah, all sorts of stuff really add to your value. And also your, yeah, as much as what you say is important, it's how you say it and how you, yeah,
Agree.
the all the nonverbal parts of it.
Good. Yeah.
I agree with what you're saying.
Agree. Well, thank you for your time, buddy. One of my friends who was from Egypt, I asked him, like, teach me a word about like Egyptian Arabic. He said, like, if somebody says, just tell them ship ship,
Ship,
they will,
ship.
yeah, they will understand. So I was just thinking about that. Well, thank you for giving me your time. I know it's very busy with the dental, being in the dental school and everything on
Thank you,
top
man.
of
No, it
that.
was a pleasure talking to you, man. And
Yeah,
I hope,
hopefully I'll see you. I'll be in Alabama next week. So hopefully if
all
you're
right.
free, we'll
Yeah,
see you.
let me know. Let me know for
All
sure.
right. Take care.
Adriel, take care,
Thank you.
man.
Thanks, Yusuf.